All right, next with the heart and blood vessel assessment is palpation of the peripheral arteries. So usually people check for the radial arteries, and you're going to check them at the same time to make sure that they're equal. You're going to make sure that the rate is regular, the rhythm is regular. You can also, if you want to check for the brachial pulses, you could check the femoral pulses, you could check the carotid pulses, of course not at the same time, you don't want them to pass out. You can check popliteal pulses, but typically you check the pedal pulses, and you're going to make sure, put your foot down, Mom. Again, that the rhythm and rate are regular. In this case, they are. Alright, so next you're going to also take for bruise. You're going to do that with a bell. What you're listening for is a whooshing sound. And I don't hear anything. So, no bruise is good. Bruise would be considered abnormal in this scenario. Next, you're going to do blood pressure. And for the sake of time, we're going to do it on one side, but the book actually says that you want to check it in both arms, sitting and standing. But right now we're just going to do sitting. So a regular blood pressure is 120/80. In this case, hers is 132/68. And then you're going to have her stand, and we're going to check it again. And this is checking for postural hypotension. And then that time it was 130/80, which there's not a huge variance there. If there was a huge variance, or if it dropped dramatically, then that would be considered abnormal. If the top number were, you can sit back down. If the top number were greater than 120, actually greater than 130, it would be considered high. If the bottom number were greater than like 85 to 90, I think are the guidelines now. Then it would be considered high. Of course, anything that's like 200/140, you're going to worry about. Anything extremely low, like 60/20, you're going to worry about. So you want it right in the middle, somewhere like that. And then you do expect some degree of variation and some dropping, or even sometimes a rise whenever the patient stands up, but it shouldn't be off by that much. Alright. Next thing you're going to do is inspect for jugular vein distension. And you're going to do this, you want the patient to be at a 45-degree angle. So in this case, we're going to go like that. And you're going to come to the side and you're going to check for the jugular vein distension. And I don't see any. And then you're going to go to the other side and do the same thing. And again, I don't see any. So you have her stand up. Not stand up, sit down. Sorry. Alright, so next we're going to look for the extremities. We're going to inspect extremities. And so, again, she would be nude, so this would be easier. But right now we're going to pretend. So you're going to inspect for color, which she's pale, but that's the way it always is. And you're going to expect for hair growth on the arms, but especially in males on the legs. Are your legs showing?
Yeah.
You can't really see anything. But especially on males, with people with poor circulation to their legs, you'll see that they don't have any hair growing on their legs. Or they're really, really, really pale. And then you can also look for edema, and she doesn't have any of those. So after you inspect the extremities, you are going to palpate the extremities. You're assessing for temperature. They should be warm. The body is cool, then, except for in this case, she's cold. But if it's really cool, then that's a sign of poor circulation. And then if there is edema, you're going to see if it's pitting. And, you know, in this case, her foot is very pale, but that's her normal. And it is very cool, but she's cold. So if you found this on somebody whose opposite foot was really tan and really warm, then you would want to be concerned, right? Okay. Next is examination of the musculoskeletal system. Alright, so again, the beginning of each body part we're going to inspect for color or any obvious abnormalities, and we're going to check for the alignment and size for various joints. Then you are going to look at the skin, you're going to look at the muscles involved in whichever body part we're looking at, and then you're going to palpate for muscle tone and for any like tumors or abnormal sites that you might see. Okay, so we'll start with the hands. Alright, so for the hands, you're going to inspect for color. You know, we've already done that. You're going to have her, you're going to check for movement. So you're going to spread fingers out, make sure she can bend them. She's going to make a fist, check for opposing thumb, and then you're going to look at the wrist, and you're going to have her move her wrist up and down. Alright, and then we'll move on to the elbow. And so elbow, you're going to inspect for color. You're going to palpate for tenderness just as you did in the hand. That would be considered abnormal if you have any tenderness or pain in the joints when movement or with palpation. So you're going to feel around. Does that hurt? Mm-mm. Good. Okay. And then you're going to have her move the joints. So if is there any pain? Mm-hmm. All right. So pain would be an abnormality there. Alright, so you're going to move up to the shoulder. Okay, the shoulder, you're going to have her shrug. Make sure she can do that. Then you're going to, of course, inspect. You're going to look at the color, make sure the color is okay, and make sure you don't see any obvious tumors or anything like that. Then you're going to palpate for tenderness and pain. Do you feel any tenderness or pain? Mm-hmm. No? Okay, that would be abnormal if she did. And then you're going to have her move it up and down, and then you're going to have her rotate it. And if there's any pain or popping, which with her she does have popping, this is her bad shoulder, but that would be considered abnormal. Okay, then you're going to move up to the temporomandibular joint. Blech. Okay, so with this you're going to inspect for any obvious abnormalities. Then you're going to palpate. Does that hurt? Mm-hmm. No. Okay. Then you're going to have her open her mouth while you're palpating. Close it. And you can have her clench her teeth. And that tests for the strength of the joint. But something else that you also may hear that is abnormal is lots of times there could be popping upon open and closing of the jaw. And that would be considered abnormal and common in people with TMJ. Okay. So next you're going to move down to the cervical spine, and again you're going to inspect for color and any abnormalities, which, I mean, she's got kind of some kyphosis going on there. You can't really see it, but kyphosis is the humpback that people sometimes get, and it's common in our family. Okay, so you're going to palpate for tenderness. Do you feel any tenderness? No. Do you feel any pain?
No.
Okay, that would be abnormal. And then you're going to have her move those joints. So you're going to have her move from left to right to front to back. And then you're going to have her rotate her neck like Linda Blair. There you go. From side to side, Mama. There you go. And you're going to make sure she can do all those things and that they don't hurt when she does them, or that she doesn't make any abnormal sounds. Alright, next we're going to move to thoracic and lumbar spine. So we're going to stand up. So you're going to palpate. Does that hurt?
Mm-mm.
For tenderness and pain. If she felt tenderness or pain upon palpation, then that would be an abnormal sign. Of course, inspection, you would look to see if you saw any obvious abnormalities. And then you're going to have her range of motion. So you're going to have her bend to the side, and to the other side, and to the front, and to the back. And then you're going to have her move her. No, you're moving your hips.
Oh. Don't move them or move them?
Don't move your hips. Okay, so you're going to make sure the range of motion is there without any pain or abnormal sounds. Alright, so you can turn around. And next we're going to do the hips. And so you're going to palpate the hips. And you're going to make sure that there's no tenderness or pain, is there?
No.
That would be abnormal. And then you're going to check the range of motion, whichever foot's good for you. This one, okay. So you're going to have her out and down, and then you can do laterally out and down, and then you're going to look at and make sure you can do that. And so obviously my range of motion is greater than hers, but I'm younger and probably a little more flexible. And you're going to make sure you don't hear abnormal sounds or have any kind of weird noises when she does that kind of thing. Okay, and then you can sit down. Alright, next we're going to look at the knees. And you're going to inspect, you're going to palpate, and make sure there's no tenderness or pain. This is on bilateral knees. Is there any tenderness or pain? Okay, no. And so you're going to check her range of motion. So you have her bend her up and bend it down. And then you can have her stand up, and I'll do it so you don't have to stand up, Mama. And then, so you're going to have her bend out, bend up, bend out, bend up, and then you're going to have her actually bend backward if she can. So you are going to look at the ankles and feet next. You're going to inspect for any abnormalities. She's got a little swelling, that's it. You're going to palpate for any tenderness or pain. Is there any? Okay, those would be abnormalities, and you are going to check for the range of motion. So you're going to have her bend her ankle up and back down and to the side and back out, and then you're going to rotate. Alright, and then you're going to move to the toes. You're going to inspect for any abnormalities. You're going to touch the feet and the toes. And then you're going to have her wiggle them, make sure that the movement is appropriate. And then you're going to do this with the other foot to make sure that that foot is also as it should be.